Welcome to the podcast, Dr. Simone Gold, who is the founder of America's Frontline Doctors. Thank you for stopping by, Doctor.
Thank you. It's a pleasure.
I just want to say, what kind of medicine do you practice?
I'm an emergency physician for more than 20 years.
That's fabulous. And you've been very involved, obviously, in COVID-19. I'm sure, boy, talking about front lines, the emergency room doctors, when this pandemic hit, were overwhelmed.
Yes. But I was on the East Coast. I was on the West Coast at the time. So as you know, it took a little bit of time to traverse America. So we were watching what was going on the East Coast. And the problem was the propaganda and the censorship. People were not being told the truth. People were being encouraged to live in fear. They were told there was no early treatment. As you know, there was early treatment. They were told that lockdowns helped, that masks helped. All of that was false. So America's Frontline Doctors got together. We are independent physicians who came to the American people directly. We spoke the truth and we said, stop living in fear. You know, we can handle this. We doctors have it. And that's how we came to be known.
What kind of repercussions did you experience when you started speaking the truth?
Oh, my goodness gracious. Well, I wrote a book a few months later called My Fight Against Medical Cancel Culture. I mean, I was fired from my emergency department jobs. I don't think I'm hireable anymore at a hospital. I think they would find me too outspoken.
For speaking the truth.
For speaking the truth. But in exchange, I ran with America's Frontline Doctors. We have more than 1 million subscribers at this point. We have brought truth to tens of millions, if not hundreds of millions of people across the world. I'm really recognized most places I go. But I'm very much a target of the government. You know, it's a challenge. It's a challenge. But the alternative is to simply live in lies. And we're not going to do that.
You're fighting against what you describe, and it's a pretty accurate description, if you ask me, medical Marxism.
Yes.
Tell us what that is.
Right. So we Americans have lived very blessed lives for decades and decades, and maybe even centuries. And we think of we think of tyranny as coming through religious tyranny or economic tyranny. We think of Venezuela, economic tyranny, religious tyranny like China or USSR. But actually the fastest way to tyranny and fascism is through medical tyranny. And the reason is people become so afraid when it has to do with their health, their physical health. So this is a tried and true technique of fascists. When you think back and throughout history, a very recent big example was in the French Revolution. Robespierre's Reign of Terror was created and possible by the Committee on Public Safety. The Committee on Public Safety, they told people, be afraid, listen to the elites. That's what they did back then. That's what they did in 2020. So that's the medical Marxism I'm talking about, is that we have tyrannical elite power brokers with vested financial and political interests who are successfully lying to people, causing them to live in fear, and then those people voluntarily give up their civil rights. That's exactly what we saw. That's what I'm talking about with medical Marxism. That's what I mean when I talk about medical tyranny. The reason I say it's turned into medical Marxism in our nation is 20% of our economy is wrapped up in healthcare expenses. And that 20% is completely run and dominated by government. So that's the government, that's the socialism, that's the Marxism. It's coming in through the medical front door.
Would it be safe to say that one of the missions of America's Frontline Doctors is to drain the science swamp? And I'm using your words there.
Yes. So I just came up with a new initiative in the last few months called Drain the Science Swamp. We've all seen what happened when these three-letter agencies curtail our freedom. If you're not in the medical space, you think of, the FBI, for example, the Department of Justice. But what about the CDC and the NIH and the FDA and HHS and Center for Medicare, CMS, right? These agencies put so much tyranny in your life. The examples are numerous. Medicare created incentives, financial incentives, for hospitals to not treat Medicare recipients properly. That's an issue that probably matters a great deal to your audience. So I'll give you a specific example. If you went into the hospital with COVID, you were encouraged by the hospital to go on remdesivir and not to take ivermectin. And if you did that, the hospital got a financial bonus. Medicare recipients didn't know that. That's medical tyranny. That's medical Marxism. We need to drain the science swamp.
Hear, hear. Last question. I would love your opinion on the recent disclosure by the FBI, by the Department of Energy, about the origination of the Wuhan virus.
I laugh when people ask me about that question because back in April of 2020, I wrote an article on this. Of course, this virus came from the Wuhan lab. Of course, it came from the Wuhan lab. Senator Tom Cotton said so. Of course, it did. You had the release of SARS-2 virus, which was being studied in a lab a few miles away from the vat market, and you really want to believe this is a coincidence? Of course, it came from the lab.
If people want to learn more about your work, where can they find you?
please go to my website, which is drsimonegold.com, drsimonegold.com. You'll find out about goldcare.com. You'll find out America's Frontline Doctors. We're here to help you. We're here to give you good information.
Dr. Gold, thank you for taking the time to speak with us.
Thank you so much.